Welcome back. This morning, we are talking about parents. We certainly have a lot to keep track of when it comes to our children's health. Measles spreading across the country, including right here in our state. And now we're also seeing pertussis, or whooping cough. This morning, Dr. Chelsea Mooreland is here to talk about these issues. She's the founding physician at Life Cycle Direct Primary Care and a board member of the Columbus Medical Association. Dr. Mooreland, thank you so much for joining us this morning. Lots of questions. I want to jump right into these diseases, measles, pertussis, those are vaccine preventable. So can you talk to us briefly about what parents need to know about vaccinations?
Absolutely. I think the number one thing parents need to know right now is to have the reassurance that vaccines are not only effective, but that they are a very low risk intervention, meaning that the side effects of these vaccines is minimal. At most, typically patients will have a low grade temperature, so maybe around 99, maybe even some soreness in the injection site, and in some cases, some cold like symptoms for a day or two after a vaccination. But otherwise, vaccines are safe and not linked to any long term consequences.
And what do you talk to parents about in terms of the safety of vaccines? Because you kind of talked a little bit about that in terms of their efficacy, but how do you reassure them that these are important?
Absolutely. I think even for myself, I think the way that I talk about vaccines has had to change over time. Most specifically, right now, I have been looking not only at how our children are individually protected, because I think that's by and large the messaging that we're sending out over the years is,
Hmm.
hey, you should get this vaccine to protect your child. But I think right now, the most important thing that we need to be saying to people is it's not just about our individual child, because by and large, many children who contract these conditions will survive and not have life-threatening complications. However, we are urging people to get vaccinated because it's protecting our children as a community, as a collective. And so it's protecting the most vulnerable children, which in this scenario includes our young children under the age of 1 and most critically under the age of 6 months who cannot yet be vaccinated for measles specifically.
And then we're in a big travel time, and a lot of people have been expressing concern about, should I go on vacation, maybe to a museum, those sorts of things. What do you counsel those parents about in terms of taking steps to protect their kids?
Yeah, so it really depends on the age of your children as well as their vaccine history. And so families who are fully vaccinated, including their parents and the children, they should not have any concerns right now about traveling because the vaccines are that effective.
Hmm.
If they have any questions about it, they are absolutely able to get what we call titers, which is a way of testing to see are they immune to measles specifically. But for families who are not vaccinated, especially those who have really young children, this is a critical time period to either consider being vaccinated before you go or ensure that you all are masking and using appropriate hand hygiene because that is how these conditions spread.
And they are so contagious. Dr. Moreland, thank you so much for joining us this morning. And we look forward to
Yeah.
having you back as we get through all of this.
Thank you. Thank you for having me.